Hi, so today I'm going to talk about lockdowns, on why we need to stay indoors, on why we should not go and meet people. Even if you're going out for a walk alone, it should be completely avoided. Well, coronavirus spreads through droplets, which means that if I'm infected and I cough or I sneeze or I touch my face, even tears now they say, I can contaminate my hands, which can contaminate surfaces. So you don't even need to be in close contact with people. Of course, the risk is higher when you are in close contact, but you can also get infected if you're stepping out, you're going to the grocery store. If you open the door, the doorknobs may be contaminated, the door surface can be contaminated, counters can be contaminated, even shelves. So you have to be like super careful. And I know that all of us do need to go out sometimes to get medicines and groceries, but then be very careful. You should not touch surfaces, avoid contact, and if you do not touch your face so that the virus doesn't get transferred to you, to your mouth or to your nose, so that you don't inhale it. And as soon as you come home, please wash your hands with soap and water. It should be at least for 20 to 30 seconds. Soap and water is far more effective than sanitizers. Then the other thing is that a lot of people who are infected but who do not show symptoms can also infect others. So on average, a person who gets coronavirus disease develops symptoms after 5 days. For the first 5 days, that person is infected and is infecting others, but does not know the disease is not diagnosed. So the risk is high. So that is why we have to stay away even from people who appear safe, who don't have a cough, fever, who are not sneezing, who don't have difficulty breathing, which are the classic symptoms of the disease. Then, of course, lockdowns have been known to work. There was a study from the Imperial College of London which showed that it was the most effective way of containing infection, of containing new infection. So, and we've got examples from China where it's worked. When China locked down Wuhan and the surrounding provinces way back in January 23, and in China the lockdown was for more than 2 months, people could not travel out. So once as we've seen in Nizamuddin in Delhi, that the outbreak in a localized place spread all across the country because people unknowingly took it out, infected others. So if those people had stayed in a contained place like China did in Wuhan, where people stayed locked down for 2 months, the infection did not spread out to other provinces as fast as it did in the initial 1 month when there was no lockdown. So it's a strategy that's worked. It's not that hard to do. India, luckily, is still at a very early stage. India is luckily still at a very early stage of the outbreak. So there's absolutely no reason for you to worry at the moment. You just have to protect yourself. You have to stay indoors because even now we can contain a sharp increase in numbers. Lockdowns also help governments to contain the infection because people are immobile at home, so it becomes easier for health workers to go door to door and check whether people have symptoms and test the ones that need testing. And it also prevents people who are infected from going out and infecting many others. So the infection can be contained. It gives the government a chance to build the health infrastructure like they're doing now. We're desperately looking for personal protection equipment for our health workers, more ventilators, setting up ICUs across state. So it's really very important. I can't stress this enough, to stay home, stay safe, and beat this infection so that we can all get back to normal as soon as possible.